A lot of my patients ask me to change the shape of their nose. Some of you might want a higher bridge, a straighter bridge, and/or a more defined, more pointed, more projected tip. You may have heard somewhere that your friend or someone you know got a nasal implant to make their nose more beautiful. Let me tell you outright, and this is the punchline, do not, under any circumstance, get an implant for your nose. If anyone offers you an implant for your nose, run.
You Are Beautiful, podcast with Jae Kim, ND.
Hi, and welcome to the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a double board certified facial plastic surgeon. I am on a mission to make the world a more beautiful place, and I want to start with you. There are 3 undeniable truths that you must know and embrace. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's get into today's content. The first thing to ask is, why would you want an implant for your nose? Now, some people have flat or wide-looking noses, and the reason is that the bridge of your nose is quite low. And so when you have a triangle that's kind of short, it looks wider. But when you have a taller triangle, a triangle with the same base width looks narrower because the height is taller. What are these implants made of? Well, there's a few materials that are popularly used for nasal implants. Some of the more popular ones include silicone or Gore-Tex or Medpore. And these are artificial materials that can be placed in the right spot in the nose to make the shape that you want, either a more pointed tip or a higher, straighter bridge to the nose. Now, why would anyone want to do this? The appeal of nasal implants is that it's a relatively quick and easy surgery, and you can even do it under local anesthesia, meaning that you don't need to have general anesthesia with IV medications and a breathing tube and things like that. The other thing is that the shape that the implant is made into, that's not going to change. So when it comes to the implant staying in the nose and keeping the shape, ideally it's going to do that for the rest of its life. So that when it comes to the actual shape of the nose, when the nasal implant is inside your nose, it's going to maintain its shape and not warp and bend over the rest of your life. So this surgery is quite popular all over the world, especially in Asian countries. Anywhere you look on Asian popular culture, so whether it's TV, music like K-pop, for instance, you'll see a lot of people, male and female, with artificially shaped noses. The cool thing about it is that some of these look pretty good. And for the surgeons that do it well, I commend them for their good work. And I do think that it enhances beauty features, especially for East Asian patients, and sometimes for other cultures where it's common to have a low bridge, such as Latino, Mestizo, or even African American noses. So now that we've talked about the good things of nasal implants, let's talk about the dark side. Full transparency, I see and hear from a lot of patients who have an issue. Otherwise, they wouldn't be seeking a plastic surgeon about their nose. So suffice it to say, I have heard all sorts of concerns from patients who have nasal implants and are now wishing to do something about it, either to remove the implant or because there's a bigger issue with the nose. Some of the issues you might experience when it comes to nasal implants is redness, infection, migration, or even the implant extruding out of the nose through the skin. There might even be contraction of your native nose tissue, and this doesn't happen immediately. It can wait years, sometimes decades, to happen. I've seen quite a few patients with these issues. I got a call from a hospital a little while back saying that somebody showed up at the emergency room with a plastic object sticking out of the tip of their nose. And it just so happens that this person had this nasal implant inserted in a foreign country. So literally, it is a foreign body. You could say it's a foreign body, but regardless, it was placed in another country. And this person lives here now in the States and shows up in the emergency room with the implant sticking out of the skin of the nose. It's kind of similar to breast implant illness, where you don't just have symptoms at the site of the implant, but you also have more generalized symptoms that affect your overall physical health. What are the common symptoms that you see when your nasal implant starts to react and reject your body? It may include redness, pain, infection, including pus and drainage and things like that. The implant may move, so it may migrate from the original site of insertion. And worst comes to worst, it may extrude or try to leave your nose through the skin. It'll actually bore a hole and start to come out. And this can result in severe tissue damage, including contraction of the nose skin and soft tissues. The troubling thing is that this may not take just one surgery, it may take multiple. This may include irrigating, hyperbaric oxygen, other adjuvant therapies to help the skin of the nose survive during basically what's kind of like a grenade exploding. Thankfully, most grenades don't ever explode as long as the pin is in the grenade. But you don't want that pin to come out and for all hell to break loose at the very middle of the center of your face. Many patients who have nasal implants may never have issues, and you may be one of them. But do you want to take that risk with your beauty? I'll leave that decision to you. As for me, I would not want anybody that I took care of to have an increased risk of something like that happening to your nose. That's why I don't perform nasal implants for rhinoplasty surgery. So, what are some good alternatives? If you still want a relatively quick procedure with no downtime to fix certain shapes of the nose, like the bridge or the tip, you may opt for an injection rhinoplasty. This can be done with a filler material of hyaluronic acid, and it could be done in an office setting with you completely awake. You can see a change in the shape of your nose immediately before you ever leave the office, and you can enjoy this changed look of your nose for several years. One risk that you must know about when it comes to injection rhinoplasty is that since the nose has so much blood flow to and from the tissue, there is a risk of what we call vascular occlusion, basically cutting off the blood flow to the skin of the nose. And this can have very severe consequences, including but not limited to death of the skin of the nose. But also, if this vascular occlusion spreads, it can communicate with the blood flow to your eyeball and cause blindness. Thankfully, I have not seen this in my practice yet, and I don't want you to be the first, but you should know about this risk before proceeding with injection rhinoplasty. The other alternative is to have rhinoplasty surgery with your own cartilage. I am a firm believer that your own cartilage is the best building block for the structure and shape of your nose in rhinoplasty surgery, especially if you want to make your small nose bigger to get a more harmonious look to your face. I would recommend getting cartilage from your own body, and there are 3 places to get cartilage. The first is inside your nose in the septum, and this is relatively easy to obtain since we're already at your nose doing the operation, and so we just need to access the septum to get the building blocks that we need. The second place that you can get cartilage to build and shape your nose is your ear, and this is specifically in the concho bowl, right where my AirPods are. And the idea here is that this cartilage is a certain shape and a certain strength. So if you want to make certain curves with the ear cartilage, it's very easy to do that. The third and final area where you can obtain cartilage to build up your nose during rhinoplasty surgery is your rib cartilage. From the sternum out a few centimeters to each side, your rib cage is actually cartilage and not bone. And it's a very good building material to augment the shape of your nose, including getting a stronger, bigger nose with a higher profile and a more pointed tip. I perform this surgery often, and we have very good results. Rhinoplasty surgery, however, does require general anesthesia, so you're going to be asleep for several hours. It does require a lot of time to heal. So when you look at your nose in the mirror, during the first few months, especially after rhinoplasty surgery, you may notice an ebb and flow to the healing process. A reminder that this change with surgery is permanent. And so it's not with foreign material like an implant. It is your cartilage, your building blocks that make this new, prettier shape to the nose. So if you want a nice shape change to your nose, especially a taller bridge, a more pointed tip, a tip that projects farther to balance the higher bridge, then rhinoplasty surgery with your own cartilage is, in my opinion, the best answer for you. There's one other thing, and this is a bonus. There's one other thing that you shouldn't do, and that's threads. Threads, as you may know, are made of suture material and can be placed in various parts of the face and or body to encourage collagen formation and sometimes to give a temporary lift. With threads in the nose, I strongly recommend against it. So whatever you've seen on social media about putting threads in the nose and making it more pointy or making the bridge taller, it may last for a short while. In the end, all it does is cause scar tissue, and you're at square one in next to no time. So I strongly recommend against nasal threads. As a facial plastic surgeon, I've seen a lot when it comes to people's noses. I've seen big noses, small noses, crooked noses, poorly breathing noses, and the like. And I'm convinced that the best way to change the shape of your nose is with rhinoplasty surgery. If you want to talk more about your nose and how you would like to change the shape of your nose and whether that's the best treatment method for you, please contact the office. You can visit the website and you can watch other episodes related to your beauty on this YouTube channel and on this podcast. Thanks for tuning in to today's episode of the You Are Beautiful podcast with Jae Kim MD. Please leave a review if you liked this content. And I'm always open to suggestions for more content and guests you would like me to invite for the show. And remember this again, you are beautiful, you are unique, and you are worth it. Until next time, stay beautiful.